Hi guys. Welcome back to RT Share Tea, where respiratory therapists live out loud. With me, your host, Linda Fry, the asthma lady. Yes. Welcome everybody. Welcome to anybody new. I just want to say, thank you everybody for the birthday shout outs. And I just want to say happy belated birthday to all my Aquarius out there. Excited to be back, and please guys, just have a little mercy on me today. I'm recovering from a cold. My voice is a little raspy, but we're gonna push through. I am super excited because we have another guest co-host, and she is amazing. We have Heather, who's gonna share her perspectives and journey going through her career in diagnostic testing, PFT, and the sleep field as a respiratory therapist. So I'm personally am excited to hear all that she's been through and how she does what she does. So before I let Heather do her thing, I'm going to read her bio and read all her accolades, and hopefully I can get through this with no problems. All right. Heather Murgatroy has been a registered respiratory therapist for more than 28 years. Heather found her passion in diagnostic testing and worked in PFT for 6.5 years and in sleep for 17 years. In 2011, she took her first job as a clinical specialist. As a clinical specialist, Heather has developed and provided continuing education programs on respiratory and sleep topics throughout North Central and South America. She also trains new customers, provide clinical feedback on products, and support sales teams. She joined Method Firm Respiratory as a respiratory clinical specialist in 2018, focusing on asthma and diagnostic testing for asthma. Reflecting her dedication to education for peers and patients, Heather was awarded the 2022 Spotty Award for the diagnostic section from the AARC. Nice. I like that, Heather. All right.
It was a
Ah,
wonderful surprise.
love it, love it, love it. Well, Heather, what can I say? I'm very grateful to have you on. Excited to hear about your journey. Um, so let's just get straight to it. Now, we all as respiratory therapists have our story, like what got us into the field. So can you tell me what made you say this is the field for me?
Sure. So I'll make it short. I was a single mom and I was going to college and I was pursuing a bachelor degree. And one summer I saw a flyer to be a camp counselor at American Lung Association camp for kids with asthma called Camp Super Kids. And it was in
Mm.
Matamoros, Illinois. And I went and I came back and I told my then boss, I'm going to go back to school full time to become a respiratory therapist. So
Nice.
I knew it was going to give me the career and the income that I needed in my situation at that time.
Mm.
And so it was just seeing the kids in the camp. I went back 2 more summers. I had groups of 9 and 10-year-old boys. So that was really interesting and fun. But it was just
Right.
the camp really impacted me, and obviously because it led to my career choice, but it also
Mm.
just kids are kids and we have to let them be kids. And so they would come to this camp and they could just run around and be crazy and do all the things. And they had medical staff available to them, the medications available to them. And it was just a really neat introduction to respiratory for me. And so in asthma and that's I just decided I'm going to go to school and I'm going to become a respiratory therapist. And I did.
Nice, nice.
So
I
yeah.
mean, at least your journey sounds very straightforward. So that's
Mhm.
good. At least you
Yeah.
wasn't like lost in the wilderness like some of us, but
Yeah.
that's a
Yeah.
nice one. And
Well, I'm
mhm.
sorry. I
No,
would
no,
say
no.
I feel like I got a little lost in the career because I didn't know what I wanted to do with it.
Right.
And so it took me a little bit of time before I kind of settled into the niche of the diagnostic side of things. But
Hmm.
yeah, no, it was once I decided it was pretty much this is what I'm gonna do.
Okay, okay. So
So
that's pretty much the next question I was gonna ask you, because just like how we pick, how did you end up in that subspecialty? Because just like
yeah.
me being in asthma, I have that story too. And
Yes.
so what made you say like, okay, this is the specialty for me?
So when I was a respiratory therapist, I was in a small community hospital, so we all, we had a lot of hats to wear, and we
Okay.
cross trained in lots of different things. And I did some nights with respiratory, and I was friends with people in the sleep lab, and they had an opening, and they, said, "Do you want to try it?" And the more I learned about it, kind of watching, the more interested I became. And it was back when there was still paper.
Mhm.
Everything was not computerized and automated. So, but when I finally got really going into sleep, it was all computerized, thankfully.
Right.
So it was just kind of a matter of being in the right place at the right time for sleep. And then it was the same with pulmonary function. It was, someone left, they needed somebody to take the place of that person. And so I said yes. And that's something that I did throughout my whole career in the hospital was if I had the opportunity to cross train, I would say yes. And so between sleep and pulmonary function, I really found that I liked that. I liked being able to take the time to educate the patients on the condition that they were in. I felt like you could really make a marked difference in their lives
Okay.
by taking them through that diagnostic process, doing really good testing to provide the physicians with the information that they need to to get the patients on the right therapies or medications. And so I really enjoyed that. I really was fascinated by how different everybody was. Like
Right.
everybody, people would say, "Oh, sleep, it's so boring. You're just watching people sleep." By the time people get to a sleep lab, they're not sleeping. So, I mean, so yes, there were nights where it sort of dragged on, but most of the time, because my lab was 2 to 1, so two patients to one therapist. One of them usually had something going on. So it was very
Wow.
rare that it was a boring night. But the satisfaction that I got out of the diagnostic process of doing the tests, the patients, it, it, it was a different type of satisfaction. Like, taking care of people in the acute care setting on the floors and in the ICU, that's one thing. You get them at the beginning of their journey. And so you have the opportunity to set the stage for them to learn and to see where they can take control of their disease process, the medications and why it's so important and clarifying those things for them. So I really enjoyed that part of it.
Yes, I definitely understand what you mean,
Hmm.
especially with PFT. I know if someone is very passionate, they usually get further with patients, and
Hmm.
I've seen it. They
Yeah.
get really good they get really good results
Hmm.
from the
Hmm.
patient when you have somebody that's like really a good coach. So you could
Hmm.
really tell the difference when it comes to that stuff, like when somebody's very really into diagnostic testing. It's amazing.
Yeah. Yeah. I mean, so much of it is the coaching. I mean, so much of it is the coaching because the patients don't know what they're doing. And then, they don't necessarily really realize how hard they have to work when they're doing the test to get it
Oh
right.
yes.
So, yeah. So the coaching is super important. And then in sleep, it's your patients come in and you hook them up to all these wires and they're scared, they're very vulnerable, and so being able to reassure them that I'm going to keep you safe, I'm going to take care of you, I'm going to make sure nothing happens to you while you're here, I see everything that's happening. It pulls out the caretaker in me to reassure them that you're going to be safe, we're going to get information, we're going to give it to the doctor, you know and we'll get you on your way. We'll help you get to where you need to be to take care of yourself.
I love it because and I love how you spoke about sleep because I would think that too. Like it would be hard for me to watch somebody fall asleep and then
Mhm.
not fall asleep. So, like I'm like, oh, that looks so peaceful. Let me
Yeah.
just close my eyes real quick. So, but I like how you said like there's like everyone is different. So it's very rare that it's boring. So it's good to hear these type of perspectives because we want people to just be like, especially those who want to leave or thinking about leaving acute care to
Mhm.
see what different options they have as a respiratory therapist because sometimes you just got to put your foot in the water before you jump right in.
Yeah.
And so that's good to hear
Yeah. I
that you
think it's saying yes to opportunity in the hospital.
Mhm.
You have to be, and it doesn't always fall in your lap. Sometimes you have to seek it out. And if you have management that is encouraging, that's really, really great. But
Mhm.
you do have to be willing to say yes and to keep
Exactly.
learning, to always keep learning.
I started as a volunteer. People don't want to hear that. They just be like, "Oh, I don't have time for volunteer." I wouldn't be where I am today, and if I didn't say yes, like, "Oh
Yeah.
yeah, sure, I want to see how that is," and
Yeah.
yeah,
Yeah.
ugh, amazing, amazing. Okay, so what barriers did you have, if any,
Mhm.
navigating through this career? Like, your subspecialty. Like, what was the like I said, if any, what was hard or
You know, I mean, I didn't have any unsurmountable barriers. I think like PFT, it was just a matter of waiting till the opening came and taking advantage of it when it did come up.
Mhm.
Sleep, th- uh, there wasn't really so much barriers in working in sleep, but I had 3 kids, young kids when I was working nights, and then I had a 4th kid when I was
Oh,
working nights, and so that's a lot of work. I mean,
it is.
that right there is a barrier, being a working mom,
Oh,
and I have a really wonderful supportive husband,
preach,
but,
preach.
it's a lot of work to work nights when you are a parent, whether you're a father or a mother. Nights are it's a hard shift to work. So in a way, I think that was a barrier. And I think as far as like a career advancement, I am a firm believer and firm supporter of continuing education, whether it's your RPSGT for sleep or your CPFT, RPFT, or your asthma educator credential, or getting your bachelor's degree. And so I knew I wasn't going to go be able to do more, and I wasn't even sure what more was without finishing my bachelor's degree. And so I did. And once I finished my bachelor's degree, doors opened up. And so I think if anybody, so in a way, I think just having that associate's degree was a bit of a barrier for
Right.
me to go further in my career. And so I am very grateful that I was able to get my bachelor's, because after that, it was like things just took off for me.
I totally agree, Heather, because I'm a big advocate for investing in yourself and your education
Mhm.
and getting whatever credit CEUs just to keep building to create opportunities for yourself. So
Yeah.
we're speaking the same language. So pretty
Yeah.
much.
Yeah.
And I just want so what and what in going into sleep and PFT, like, did you take any specific training? Because I know you kind of just said like the opportunity came and you kind of
Mhm.
just went in. So did you
Yeah.
have to take any, did they make you get the certifications
They
or
did.
like how did that
Yeah, so no,
happen?
they didn't, which I think
Okay.
is really interesting. And I do find working with pulmonary function labs in my current role, more and more hospitals are requiring the CPFT, RPFT exam, which I absolutely support. And I think I I wish I had been pushed for it. My hospital at the time did not give any reimbursement for review courses or for
Mm,
testing, which is a
okay.
barrier for people. Um,
Right.
and
Yeah.
I actually didn't get my RPSGT until after I left the hospital setting and became a clinical specialist working specifically for a company that had sleep devices. They supported it. They paid for a
Okay.
review course and they paid for me, but I was still
Nice.
PRN in sleep. So I was still working in the sleep lab, even though I had left the hospital setting. I stayed PRN in sleep from 2011 till 2018 because I couldn't
Okay.
leave the bedside. I just couldn't leave. So I wasn't working in the hospital otherwise. I was a clinical specialist for a manufacturer. But I took the RPSGT test then. But while I worked in the sleep lab, now it's required. But when I was there,
Okay.
I was kind of grandfathered in or whatever on the job training. As long as I was a respiratory therapist, it was okay. So
Okay, okay. No,
yeah.
that's good because I know now. I want to say yes. Now they really want like for PFT, like they're looking
Hmm.
for the
Yeah.
CPFT
Yeah.
and sleep. I don't know that many people in sleep, so but I know there is
Yeah.
a certification for that as well.
Yeah.
Like
The RPSGT and then I think it's sleep disorder specialist,
ST,
SDS.
yeah, right,
Yeah.
SDS. Uh-huh.
Yeah. So I think, I get pushback when I've talked to people about, I think it's important that you do these things. I think continuing education, advancing degrees, credentials, some people, well, it doesn't change your pay, but it's an investment in yourself. It shows that you're
Correct.
investing in yourself
It
and
is.
your career. You
Correct,
want
correct.
that education. Things change. Things
All
change
the
in all.
time.
Yes, yes,
It's just like all the time.
yeah,
While I was on maternity leave for 6 months, and in the asthma world, so many things came, and I just like, okay, there was a new updates to the guidelines, new
yeah.
medications, new biologics. It's crazy within six
Hmm.
months.
Yeah.
So yes, we do have to, and I also say that to other therapists as well when they say, oh, the pay, there's no pay difference or no, incentive. some Eventually the incentives
Mhm.
do pop up, because the same thing happened to me. My hospital did not pay me to get certified as an asthma educator. Matter of fact, my supervisor was like, when I told her, she was like, "Oh, that's nice, Linda." That was it. And I was like, I was like,
Yeah,
"Oh, okay, it's cool."
yeah.
But I still, went, I volunteered. And when opportunities came up, people, of course, thought about me. They were like, "Oh,
Hmm.
we have this position, whatever." And it was a chance for me to make extra money, right? So the
Right.
opportunities do come. So I
Yeah.
wouldn't, I tell folks all the time, don't let stuff like that stop you. You know what I'm
Right.
saying?
Right.
So
Right. It
preach.
will it will be a benefit in the end. Like in the
Right.
long run, all that investment, whether it's time studying, time taking tests, financially investment, it will pay off. I really do firmly believe just what you're saying. I absolutely believe that that's the case.
Okay. Okay. So what pretty much you answered the next question, because I was gonna ask you, what would you tell somebody that wants to be on the same journey, the same path of being in this specialty? Like,
Yeah. Well, one of the coolest things that I have experienced over the last couple of years is when I talked with students and they say, "How do you get to do what you do?" As my when I because when I present and stuff at conferences, and I just say, "Put in your time in the hospital. You have to do the hospital. That's absolutely invaluable experience, and say yes. Just say yes all the time. And maybe it's something like a community event,
mhm.
the Chamber of Commerce where they have like business expos, and maybe they have the hospital has a booth at the business expo, and you're doing maybe whatever they will do there. Say yes to those things because you just never know when that is going to help you make that next step in your career. And so just
Mhm.
always say yes to cross training. I cross trained in phlebotomy, EEG, some cardiac testing, sleep, and PFT. And it just shows flexibility, I think, as well on your part. And it keeps you in that always learning mode in your brain. And so,
Mhm.
you're always learning and it will pay off. It will pay off if you
I'm
just say
telling
yes.
you. We are totally speaking the same way, because I love when people talk like this, because it does help you become kind of like a unicorn. Like, it's a
Hmm.
scary thing when you can't stop somebody that keeps learning, because no one can take that away from you, right?
Right. Right.
So that person is able to just keep advancing and
Hmm.
creating opportunities for themselves. So it
Right.
it is it is so true to just say yes,
Yeah.
keep going. And especially in your, like, in sleep and well, there is I know, like I said, I do know a lot of folk in PFT, but
Hmm.
not that much in sleep. So I feel
Hmm.
like that's its own. You're like, you could talk and
Yeah.
help people with that field, because
Yeah.
not that many people that's doing it.
Well, even now, I have had some encounters with physical therapy because I had knee surgery, and both of the physical therapists that I work with, as soon as they heard that I had worked in sleep, had all kinds of questions for me because they
Mm.
both use CPAP,
Uh,
and so
you
as
understand?
soon as people that is such a conversation starter. And I'm sure you get stuff like that when people learn that you're an asthma educator. I'm
Yeah.
sure you get
Oh,
questions all the
yes.
time. It's party talk, but it's really cool because I love to talk about it. I love to talk about sleep. I'm pretty removed from it now, obviously, and not having been in it for the last several years, but
Mm.
I still keep up and I still think about it. And you know, the biggest thing I tell people when they're like, "Well, have you heard about this therapy or have you heard about that thing on the online and these things that you can get?" And I always feel like, try things. Don't invest a lot of money in
Right.
unfounded therapies. We have a lot of things that are FDA approved and that are shown to be beneficial to patients. But
Yeah.
do your due diligence and find what works for you. But don't spend money on weird sham things that you see
Right.
online, because people come up with the craziest stuff, and it's like, oh, I don't know. I don't know if that's been tested. So, but people always have questions about sleep. Always.
I
So
mean, sleep is an important thing in life,
it
just
is.
like breathing.
Yes, exactly. Exactly.
Yes,
Exactly.
yes, they
So
go hand in hand. Yes.
they do. You can't have a good life without, if you miss either one of them.
Without one
So
of the
yeah,
one or the other.
yeah,
I
yeah.
can't.
So
Okay, so no, this is great. I'm happy with this conversation. It's
yeah,
entertaining
yeah.
me. Was gonna say, so yes, okay, well, this is your opportunity to plug, Heather, whatever you have going on, what's
Sure.
new, what you want to tell the people. Go ahead.
Sure. Well, one of the things that I was kind of thinking about, I mean, obviously, I'll talk about my company in just a second, but I am part of a group on LinkedIn that is called Women of Respiratory.
Mhm.
And it's just kind of a grassroots group where I was talking with another respiratory therapist, and we said, there's a lot of women in leadership with the AARC and the NBRC. There's a lot of women leadership there. But I know you speak at conferences, I speak at conferences. There's not as many women speaking at conferences. And so
Oh,
that's really a pet project of mine, is to empower. There's a lot of knowledgeable respiratory therapists who are women, and we're the majority in the field. And also pulmonary disease hits us harder as well later in life. And so one of my goals for this group, it's kind of in its infancy, and we're building, trying to figure out what exactly people want, and how do we, is it just networking, is it a mentoring kind of thing? um, One of my passions is to help empower other female respiratory therapists to be presenters and to take
yes.
that risk. And I know it's scary, and you know it's scary. I know you do
Oh,
it too.
oh, I do.
But it's like, it can be really fun, right?
Yeah,
You're putting yourself out there, and it is, but it's you're sharing information with your peers.
correct.
And
Correct.
and when you have a light bulb moment, and they think, oh, I didn't think about asthma that way, or I didn't think about COPD that
Different
way, or
perspectives.
it's such a cool thing. And so if
Mhm.
I could help anybody achieve that goal, I would love it. But
Nice.
maybe there's women who want to become educators. So there's educators in the group that we could, hook them up with, or maybe they want
Oh,
to get into industry and do sales. There's sales in there. So there's
nice.
different women from different areas of what we can do as respiratory therapists. Like, if you
Nice.
want to leave the hospital, and I know it's like, I have a little bit of there's a little bit of conflict in me, because I know that we're short respiratory therapists in the
Oh,
hospital, right? So you
right.
don't want to pull too many people away, but I want
Mhm.
people to recognize there's a lot for us to do out there.
Correct, correct. And
So,
I'm the same way too, even though, because like I always talk about the asthma education stuff and becoming an asthma educator. Not to say like, we don't want people in acute care. We need folks in acute care.
yes.
But for those that feel kind of lost, or
Hmm.
they just want to hurry up and leave the field, I'm like, hey,
Right.
listen, come check out this side, and
Yes.
come check out the other stuff. There's other
Yes.
stuff out here to do,
Yes.
you
And
know?
you don't have to, you don't have to leave the hospital setting
Right.
either. You could stay as an asthma educator, you could become a
Correct.
COPD navigator, you could get into the diagnostic side of things, you could
Yes,
get
ma'am.
into um, accreditation things. I mean, there's things to do within the hospital system as well,
Yes,
but there's
ma'am.
a whole lot of things to do outside of the hospital. And I hope that this group, we just can kind of help broaden um, and help women get to the different things that they want to do within the respiratory field. Because, you know, we have a lot to contribute. We have a lot to offer. We have a lot to say, and we have a lot of talent. We have a
Uh,
lot of talent. So,
Amen.
yeah.
So
So,
just give me the I'll put it in the description. Just give me
okay. Yeah. Yeah.
yeah,
So,
I'll put it
women of
in.
respiratory care, and that's just on LinkedIn. And then the other thing, I am a clinical specialist for Methafarm, and Methafarm provides provocholine, which is the only FDA approved methacholine chloride available for the methacholine challenge, which is diagnostic. And then we also have mannitol, which is the Aridol challenge, which is mannitol, a dry powder. And that's another type of bronchial provocation challenge. So that's what we do. Like, we work with pulmonary function labs and physicians to bring awareness to, if the spirometry that you do on your patient is not clear, does not give you a clear path to diagnose your patient with asthma or something else,
Mhm.
bring in those bronchoprovocation challenges They're readily available. So we have, those are just two of them, but those are the two that I represent. So I go in and I do hands-on training with new customers because they can be kind of confusing and complicated tests, and there's timing and things that we have to pay attention to. So we have a really good training program for that, and I really enjoy it. And then
Nice. Okay.
also, writing education. So Methafarm is a huge supporter of continuing education for respiratory therapists. So on our website, which is methafarmrespiratory.com, we offer 4
I saw that. Nice.
non-traditional,
Yes. The free
yeah,
CEUs.
yeah, they're
Okay.
free CEUs. 3 of them pertain directly to the methacholine challenge, and the 4th one is for Aerodol. And they are PFT content specific. So if somebody has the
Okay.
CPFT or RPFT designation, it it covers the requirements for that credential. And then I
It
also
goes
have
to, do you know if it goes for the asthma one too? I don't know if
the
that
asthma
would.
educator. I haven't,
I would have to double
I
check.
wonder
Right.
if I have never requested that. I never thought about that, but I can see if I can designate it for 2 because that would make
Right.
sense.
Yeah, because for it's hard for us to get
Yes.
asthma specific
Yeah.
CEU too.
Yeah.
You have
Yeah.
to be specific to that.
You know
And
what?
so
Let
but
me,
PFT is,
I will
you
double
know.
check because if I can earmark it for 2, I don't know. I'll have to check with the
Right, right,
AARC
right.
on that, but thank you for suggesting that because I will for sure look into it. And then we also have 4 traditional or live CRCEs available. And they are PFT content specific. A couple are specific to, one is kind of a broad, is it asthma, and talks about demographics and economic burden and testing that's available for asthma. And kind of and highlighting the importance of diagnostic testing because we know, just like with our COPD patients, so many of our asthma patients have never had spirometry, and yet they have this asthma diagnosis. So it talks about that and talks about briefly goes into the diagnostic tests. And then I have 2 that are specific to the direct and indirect challenge tests available for patients, not only ours, but all of them. And then the 4th one is on phenotyping and endotyping asthma. So I don't know how
Mm.
much you guys are getting exposed to that as asthma
No,
educators. Pheno,
Pheno is new for, yeah, it's coming.
yeah,
We have a new pulmonologist. So yeah.
yeah. But as far as like endotyping asthma, so looking underneath like eosinophilic stuff and all the inflammatory markers that are getting more and more recognition, and how do we target them with the biologics and stuff. So that's what the 4th one is covering. And then I'm writing one on chronic cough because that's
Mm.
one of the number one reasons people go to the physician every year. So
I, shoot,
you got a
right.
cough?
Sign me up for the chronic cough. I think I
Yeah.
got that down.
Yeah.
It's
So
like,
I'm really proud of Methafarm's dedication to providing continuing education for respiratory therapists and truly providing really good standardized testing as far as the bronchial challenges for patients so that we can get them the right treatment and get them on the right therapies and get them the right diagnosis, right? And
I
so
agree.
I'm really proud of that that's my company. Like I love the fact that they are so dedicated to really good quality patient care and the diagnostics side of things. So it's where it all starts. That's what I tell the people in the PFT lab. Your job is so important because you're where it all starts. It
Right.
should all start in the PFT lab.
It's true. It's and then for someone like me who works with both well, more pediatrics,
Yeah.
but also
Bless you.
work with adult. I see it all
Mhm.
the time. I read the notes, I look at the history, and I'm like, this is not an asthmatic patient. Like it's like you can it's just like, yeah, this person needs PFT, or they say things like, oh, they have asthma, but never got ever
Yeah.
any type of spirometry, but they're just relaying that, oh yeah, I've had asthma since I was like 10, or
Yeah.
but it's
Yeah.
not, the characteristics is not all there. So yeah,
Yeah. Well, I
PFT.
appreciate your work in that regard too. I think if enough of us are like, no, these people need to have these tests,
Oh,
maybe it'll become
oh, we
more,
don't play.
yeah.
PFT. I have well, I'm a respiratory therapist,
Hmm.
so I have my friends in the PFT lab. They
Hmm.
schedule my patients. It's like Linda's list. Like,
Yeah.
so they get my pediatric patients in right
Yeah.
away. We don't play with that stuff. So yeah, I don't play with Our asthma team does not play with the PFT stuff. We
Yeah.
especially those newly diagnosed, like, we're really trying to
Mhm.
figure out what's going on with them. So
Yeah. Yeah.
yeah.
Good. We can all
Amazing.
work together.
Amazing. Well, Heather, thank you so much for being on RT Shanty. I love your perspective.
Thank
And
you.
I've learned a lot actually
Yeah.
just talking to you. And like I said, I don't know too much about that world.
Mhm.
But it does sound interesting. So
Yeah. Yeah.
I'm
Well,
gonna
thank you
put
for having me on.
oh
Thank you. And I honestly, I really appreciate what you're doing. I think that this is wonderful. Just bringing awareness and bringing respiratory therapists together to talk about things. I really, really appreciate all the work that you've done.
Thank you so much, Heather. You know what I'm saying, for the respiratory care field, I just want to show people that there are opportunities, and
Hmm.
you said it all through just us talking. There are opportunities out there, so I just want folks
Yeah.
to get all these perspectives,
Hmm.
especially from women too. I do
Hmm.
showcase, women as well.
Yeah.
That we doing different stuff, like, so this is good. So what I'm
Yeah.
gonna do is all the stuff that you mentioned, I'm gonna put in
Uh-huh.
the description,
Okay.
and so folks can know where to get their CEUs and all
Hmm.
that good stuff. And if they need
Hmm.
any more information about the field that you're working in, or how to get in contact with you.
Okay.
Oh, yes, yes. Well, Heather, thank you so much for being here with me and at RT Shanty. Guys, thank you so much for watching. I appreciate you guys. Know that we are here every Wednesday on Google Podcasts and where you can catch your podcast. And we are on YouTube every Thursday. Thank you so much, guys. I really appreciate you once again. And remember to invest in yourself and to only compete with yesterday's version of you. Have a good one. Bye.